This is Bose Hamill from the Culinary Institute. This video deals with DMEK, or Descemet stripping endothelial keratoplasty. The procedure begins with preparation of the donor. As you can see, the eye bank is stamped an S on the underside of the cornea, and I'm using a blue dye so that I can find the edge of the dissected Descemets. With removal of the blue dye, the edge of the eye bank dissected disc is clearly visible. Using a circular punch, the donor Descemet is punched, and as you can see, the area of the donor material is actually smaller than that separated initially by the eye bank. Here I'm removing the extra material, and here I'm removing the actual donor portion that we will be inserting into the patient. This contains Descemet's membrane and the pump cells that we're replacing. Several small incisions are made into the cornea, and the internal portion of the eye is irrigated with topical anesthetic to achieve anesthesia. The area of the patient's cornea to be removed is marked on the front of the cornea with a circular marker, and these marks become quite clear when the cornea is dried. Using a special hook with a blunt tip, the patient's endothelium and Descemet's membrane are fractured and gently stripped free from the overlying cornea. As can be seen here, as the dissection proceeds, the edge of the Descemet's membrane can be seen in the pupil as the hook is brought past. Incision is made in the cornea, and then using a pair of forceps, the free edge of the Descemet is grasped and then stripped clean off the underside of the patient's cornea to be removed in one piece. The donor Descemet, which has been resting in saline solution, is now stained with a blue dye to allow it to be seen inside the eye. Without this staining, it would be essentially invisible. As can be seen here, following staining, it's clearly visible. The donor material is then aspirated into the injector, which is a small glass tube connected to a syringe. The glass injector is then inserted into the main corneal incision, and the donor material inserted into the front portion of the eye. As can be seen, it remains scrolled up in position. The main wound is then sealed closed with tissue adhesive. The donor scroll is then opened with a series of tapping movements on the cornea to make little micro movements of the fluid inside the eye so as to indirectly manipulate the donor tissue. As is not uncommon, this donor, on its initial opening, is upside down, as can be detected by the upside down S mark, which allows orientation of the tissue and needs to be flipped over. This is done by the series of small puffs of saline solution. The donor is eventually flipped into the correct position, and utilizing small tapping motions with these cannulas, the donor button is opened. As you can see here, the S is in correct orientation, and the donor button is reasonably well centered over the pupil. When the donor button has been placed in satisfactory position, gas is injected into the front portion of the eye to hold the donor in place and allow it to heal. Massaging movements are made on the surface of the cornea to squeeze out any residual fluid that may be trapped between the host and the donor tissue so as to promote adherence. Following this, the bubble is released to relieve approximately an 80% gas bubble in place, and post-operative drops are given, and the patient is taken to recovery.